Good morning, everyone. I'm Kim Schatzel, the president of Towson University, and I just want to welcome everyone to the staff town hall that we're having this morning. Before I introduce my colleagues, I want to just take a moment to just thank everyone across campus, all of you, as well as the faculty, for all the work that they've been doing these past few months, and particularly in the last couple of months, to be able to prepare the campus for the return to campus as well as the return to classes. I don't want to take any more time in terms of any comments, because I really want to make sure that we give all the time that we can to be able to answer questions from all of you. So with that, let me just introduce our colleagues. We have Steve Jones, who's the Associate Vice President of Human Resources. We have Ben Lowenthal, who's the Chief Fiscal Officer and the Vice President of Finance and Administration. We have Vernon Hurt, who is the Vice President of Student Affairs, and Melanie Perot, who is the Provost and Executive Vice President of Academic Affairs. So with that, I'll turn it over to Marina Cooper, who is the Vice President of Marketing and Communications, and she's going to be handling the questions for us. Marina?
Good morning. I want to remind all our participants that you can use that Q&A function located at the bottom of your screen to ask the questions. We haven't had any in quite yet, so we're going to start with some of our frequently asked questions that have come in through our live chat and our Ask TU email. So one of the first questions has come up to the panel, and this is actually a question that we've seen a lot come from staff. If no childcare or K through 12 schools are remote in the fall, will teleworking be permitted?
I think I can start with that, and then Steve, I'll ask you to stop in as well after I do that. The first thing that I want to make sure that everybody understands is the fact that the campus that we left is not going to be the campus that we return to. And the first thing that we're doing in order to prepare the campus is to lower the density. And we're doing that with the students, we're doing that in the classrooms, we're doing that in all the conference rooms and administration buildings as well. So what that means is the fact that we're going to encourage telework. We're going to encourage people that can do their job telework, either full-time or part-time, to continue doing that. And over the next couple of weeks, your supervisors will be able to contact you for that. The question of childcare is something that I totally understand as a parent. I also understand that the public school systems have not really communicated yet in terms of what those schedules might be. Plus, we have a lot of faculty and we have a lot of students as well as staff that come from different counties and come from different school districts where it could differ. So the one thing that I want to be able to say is understand the fact that teleworking is going to be a preferred mode for us, either part-time or full-time. And you're going to be working with the supervisors to be able to do that. Steve, do you want to add to that?
Yeah, the only thing I'd add is that the COVID telework policy that we put in place back in March will continue to be in effect. So it's a modified version of what we had before, which acknowledges that in some cases you may have to telework and watch kids. And we're going to be as accommodating as we can be to make sure that we can address individual situations as they come up.
Great, and I have a follow-up to that, Steve, and this one's through TUS. How will it be determined what staff can continue to work remotely? For example, if a staff member is concerned about health issues that they're dealing with, their age or their husband's age, how will managers and supervisors determine who can work remotely?
Great question, and I know it's a question on the minds of many of our staff. The first thing that we did, I guess it's been a couple of weeks ago, is that we canvassed our managers and our supervisors to really find out which positions could truly support telework either fully or in some sort of a hybrid fashion. And we also identified positions that couldn't sustain telework long term. So we have knowledge now about what positions can and what positions maybe can't sustain telework for an extended period. And if we have individuals who, for whatever reason, as the president's indicated, are unable to come to campus, obviously the first option would be to telework if that's available. And if the telework isn't available, then we will work with the individuals to see what modifications we may be able to make to provide some work. Excuse me. And if that's not possible, then we'll have to work on an individual basis about how we can accommodate the individual situation over the extended period, because we just don't know how long the pandemic is going to last. But we also know that we want to preserve our human capital, our people, and make sure that we can do whatever we can, whatever's necessary to accommodate an individual situation. And that may be a combination of, personal leave, annual leave. It may be a combination of sick leave, but we're going to do everything we can to make sure that whatever situation we come into accommodates the individual need as well as the need of the university.
You opened up the door, Steve, about leave, and so this is the perfect follow-up to that. If there's not enough work to sustain working full-time at home, for example, for the rest of the summer, will part-time work or administrative leave be available to receive full pay?
Again, another great question. I think everybody remembers when we vacated the campus back in March across the USM, including Towson. We certainly said that whatever we need to do, we're going to preserve and protect the finances of our staff and faculty. And looking forward, now that we have a better idea of what work can and can't be accomplished on campus versus off campus, we're targeting in early August. Again, I know there's a timeline that everybody wants to know about, and we're finalizing that. But we're projecting now that by August 10th, we'll be in a position to have the campus ready for our students to return. And to answer the question about leave, administrative leave going forward past the 10th, it won't be an option. And individuals who are unable to come to work, or individuals who have situations where they may not be able to come to campus if that's what is needed, we'll have to explore options of personal leave, annual leave, and sick leave to help them from a pay perspective. And each of the individual situations may be a little bit different, just depending upon the situation, because we've got health-related situations, we've got non-health related situations, and it's really difficult to kind of blanket all of those. There's a Family First Coronavirus Act that provides for some pay protection, and some people will qualify for that. That also includes some individuals that have childcare situations as well as health situations. So we're going to be exploring every alternative to make sure that we can do everything within our power to preserve and protect the staff members relative to pay.
Thank you. This question is going to be directed to both the president and the provost. What is TU's plan in terms of international students regarding the Department of Homeland Security's most recent advice regarding international students and online courses?
Provost, do you want to take that? We had some conversations about it yesterday as well.
Sure. So I'm happy to take that. So we are 100% committed to all of our international students. So we are making a guarantee that none of our international students will be displaced due to this policy. So we're still waiting on federal guidance on some of the really the meaning of some of the directive. So what exactly constitutes a hybrid class? We think we're already in good position because we haven't declared the university to be all online. That's really where what it was targeting. So we've already announced we're a hybrid and a face-to-face campus in the fall, so that helps us out tremendously. But we'll be working individually with every international student, and we are making an absolute guarantee that we will find a way to make sure that they comply with the federal policy, and that nobody is deported because of this this new policy.
Thank you. On another question around this one, more around health protocols and mask guidance. The question is, detailed mask guidance is supposed to be coming out soon. When can we expect it? And more specifically, following up, outside, do I need to wear a mask even if I'm able to stay 6 feet apart?
So let me jump in on that first, and then Steve can be able to follow up on that as well. First of all, we have two committees that we've established broadly. One is a return to campus and one is a return to classes. Steve Jones has been co-chairing with Sarah Slaff the return to campus. We've just received a tremendous amount of support from the individuals and the various task teams to put the protocols together. We've also been very fortunate as a university that we have the University System of Maryland. So we've been able to access resources from the other campuses to come up with best practices, as well as the medical school and the medical center. So when it comes to safety precautions, of course, we're always going to be compliant with the CDC and state and local regulations. But in addition, as I said, we're able to tap into a lot of experts in terms of what we need to do, such as masks. Masks we're going to be a mask on campus, and that provides the fact that in the buildings, masks are going to be required. And that's every building and every situation. We're also going to encourage social distancing and basically washing your hands. If you read all the research around being able to prevent the spread, it's mass social distancing as well as washing hands. We'll also have various deep cleaning that goes on in the classrooms, and those stations are going up. The question about outside is the fact that to take them off outside, as long as you can socially distance, will be allowed on the campus. We prefer the fact that people always have them on because you don't have to think about it. But we also understand that there's going to be mass fatigue. For example, people could be in the buildings or walking around and they want to be able to do that. For those of you that are not aware of it, and we'll probably hopefully put some pictures up, the quad where the Stevens Hall Annex existed has been torn down, and we put a tremendous amount of outdoor furniture that's there. It's going to be spaced out so people can enjoy it. We also have another order that should be coming in 4 to 6 weeks. So we're hoping to put lots and lots and lots of outside furniture, both in West Village Commons over by the CLA, as well as I said, in the quad that where the Stevens Annex was, so that people do have the opportunity to be able to enjoy the outside and take the mask off at that particular point in time. But social distancing and lower density is all what it's a part of. I want to just remind people that the campus, as I said, that we left is not the one coming back. We're looking at the fact that at any one point in time, probably about 70% less people will be on campus. So the ability to be able to socially distance will be enhanced by the low density itself. Steve, do you want to add anything about the expectation of when that mask policy is going to come out?
Yeah, good question on the mask. We had an extensive collaborative effort to develop the mask protocols. As the president indicated, we had a task leader, Nate Barker, out of the Office of Human Resources, who worked with a group of staff from across and faculty from across the campus. And those protocols have started to be communicated and will be released. We finalized it actually last Thursday. And just one thing I'll reference is that a mask or a face covering. And again, we are encouraging, obviously, the mask, but face coverings are also part of that protocol. And all of you all have been out and about and seen masks in different places that you visited or frequented, whether it's grocery stores or restaurants or wherever you've been. It's going to be really important that all of us take responsibility to wear the mask, because what we're hearing is that that's one of the primary ways for us to keep the spread of the virus, or maybe keeping the virus from coming onto campus. And not only is it important to wear it, but it's important to wear it correctly. And the correct wearing, obviously, is to cover the nose, the mouth, and to have it extend below the chin. And you'll see that in the protocols, but the communication of that's already started, and it should be, I believe it's going up on the COVID website if it hasn't gone up already, and we'll distribute that more widely by the end of this week.
I'm going to stay on the mask topic since we've got a few questions there. Question is around enforcement. Who enforces the wearing of masks for faculty, staff, and students? And then the follow-up, I believe we've touched on this, but are you required to wear them in individual offices if you're the only one there and have the ability to close a door?
I'll take the first part, and Steve knows the details more of the mask policy itself, so I'll ask him to comment on the offices. Similar to the fact that we're a non-smoking campus, similar to the fact that when someone comes into a classroom, I always use the example of the fact that if somebody came in without their shirt on, we'd say, you need to have a shirt on. Similar to the fact that it's a non-smoking campus, if somebody was smoking, we would tell them to put it out. So part of this is social normative behavior in terms of having that requirement there. But I can tell you the fact that if somebody decides that they're not going to comply with this regulation, that there's action that can be taken. From the student side, it can be conduct issue, and also from the employee side, we're dealing with performance issue as well, because this is a reasonable expectation. If and when it would get to the point, and I hope it never does, that somebody just wouldn't be able to comply, there would be expectations of the fact that public safety could be called. But understand the fact that we're going to do a lot in terms of educating people and asking them to take personal responsibility. Caring is wearing is the tagline that we're talking about. We're hoping that the positive reinforcement and planning that positive reinforcement is there. This is all about taking care of each other. We're going to be sending a care kit out that should be arriving at starting in another week or two. And in the care kit, to every single employee on the campus, faculty and staff, as well as students, they're going to be receiving a mask. They're going to be receiving a digital thermometer. They're going to be receiving sanitizer, one of those key touchpad things that you can be able to use in terms of elevators and door openers, as well as the fact there's going to be a personal pledge that Steve said, that people take personal responsibility for complying with the mask and all the other safety protocols that we have. It's important for all of us to do it, and that's the way that we're going to do it as a community. Steve, do you want to just add a bit there?
Again, the responsibility is going to be one that we each have to take on ourselves. And as far as the enforcement of the policing, obviously it's going to take time for people to get used to it, but we need to remind people it's not going to be we're going to go out and search for people that aren't wearing masks, but we're going to be vigilant because we know it's the safety and health of our community that we're trying to protect. And I would make a couple other comments that face coverings and face masks are covered in the protocol, but I should point out that face shields do not replace a face mask. And we've had that question come up. And you'll see plexiglass hanging in different parts of the campus when you come back. And that plexiglass also does not take away the need to wear a mask. As far as offices, the protocols, and again, this is following CDC guidelines, the protocols specifically say if you could be in an individual office and close the door, then it's okay to take the mask off. But other than that, we would expect that the mask would be worn indoors in all of our facilities, regardless, whether it's a classroom or whether you're standing in a hallway talking to people in cubicles. The masks are expected to be on during regular conversation and during the course of business throughout the day.
Excellent. And Steve, you touched on this already, but there was a question around, will anything be done to protect staff in cubicle workstations, especially those with low panels and high traffic areas? That might also be something that Ben could touch on as well in terms of what facilities is working through.
That's a great question. Part of what we've been trying to do across the campus, and I'll let Ben speak specifically to the facilities group, is to look for those areas that are high contact, some of the customer service areas, the intake areas, reception areas, is what can we do to put a plexiglass barrier up as another safeguard in addition to wearing masks. And we've identified those, and they've already started to be addressed across the campus, and Ben can give you an update of that in terms of the number and where. I will say this, that the plexiglass itself isn't necessarily a be-all, end-all either. And what we want to be cognizant of is when we begin to return to work, we're asking managers and supervisors to assess the work environment and to make sure that when we bring people back, that we're conscious not to create a density by having multiple people come into for example, where we have multiple cubes together, which many of you are familiar with. We don't want to create a situation where we're creating density unknowingly, and then putting maybe potential people at risk, even with masks. So again, part of that is the return to work, assessing the work environment, and making sure that we don't create a situation of high density of individuals. That being said, we're also asking managers, including the deans of the colleges, to identify additional areas where maybe we ought to look at putting plexiglass in. Balancing that with the nice to need to. We know there are some areas where people would like to have it, and from a protection perspective, it may not be a high priority, or it may not be in terms of what we anticipate from a work perspective necessary at this point. But we know that this is going to evolve, and what we know today might change tomorrow or next week, particularly around where we put plexiglass and where we put barriers in place. Ben, I'm going to share some of the details on the facilities.
Yeah, thank you, Steve. So just to give you a little bit more detail, plexiglass, we've been studying that across the campus, and there's approximately 150 locations at this point in time where we're installing or have already installed the plexiglass. Those are in, as Steve mentioned, really the high contact areas, things like bursar's office, walk-up windows, res halls, walk-up windows in the res halls, bookstore. Those are the places that are extremely high contact, and we want to add that extra layer of protection I'm going to repeat again, though, the science says that the mask, as already the president has mentioned, is really what protects you and us. So wearing that mask at all times is really critical to the protection of the entire campus. And as Steve mentioned, in the cubicle areas, each individual leader in those areas is going to do a walkthrough to make sure that there are low densities in those areas, and they're working directly with us, facilities and environmental health and safety, to ensure the safety of everyone on campus when they do return. In addition, what's really critical is that everyone avail themselves of the more than 260 stations across campus that have both sanitizing wipes and hand sanitizer, and those will be restocked regularly. And that is the best way also to protect ourselves, is to make sure that we wipe down your work area as many times as you want during the day, so that you can be comfortable with that. In addition to that, ABM will be doing multiple sanitizing throughout the day in all high touch and high contact areas. So they are increasing the amount of times that they're cleaning things like faucets, door handles, elevator switches, all of those things multiple times daily throughout campus.
Excellent. Hey, Ben, while we've got you here, can we talk a little bit about budget? One of the questions is, how will the cuts to the state budget impact TU? And then there's a follow-up to that about, you've been clear that furloughs would be a last resort, but are there any plans to offer voluntary early retirement incentives?
Okay, thank you, Marina. So yes, we are not going to do furloughs or layoffs. So there's a last resort. And at this point in time, given everything that we know, we're very confident, given our strong financial position in the past, and as well as all of the measures that we've put in place, which we've talked about, are the many tools in our toolbox, including the hiring freeze, which is a hard freeze, including the fact that we've asked you to purchase only things that are absolutely essential for the business of the university, and the travel freeze as well, where travel is only in the state of Maryland and DC. All these things combined with the fact that we have had strong financial positions in the past put us in the position where, again, we can protect our most valuable asset, which is all of you. So we are still not planning to do furloughs. We are not planning to do layoffs. And at this point in time, we don't have any plans for early retirement. That is not part of the financial plan at this point.
Thank you. Is there a tentative date that staff will return to campus so we can plan for it? I think that's probably best for AVP Jones.
Yeah, very good question. That's obviously something that's very important to everybody. And the key date that we've backed everything into would be the start of the fall semester, which is August 24th. And looking at the calendar between now and then, we've got a couple of critical dates that I think are important for staff to know and for the rest of the campus to know. The week of July 20th is going to be a key week, because that's a week when you'll be receiving the Tigers Care package, and you'll be getting more information about the return, some information just to bring you up to speed as far as expectations when you come back to campus. And the managers and supervisors are going to be completing their walkthroughs of the different work areas, so we can identify any potential changes or any tweaks or modifications that we need to make. That being said, we anticipate the week of August 3rd is when we were going to begin to see the major phasing back in of staff, although some may come in prior to that based upon the job duties that they have. So if I could give you direction, it would be to anticipate no earlier than the last week of July, no later than the first week of August, in terms of whether or not you'll be returning back to campus or that you'll need to come back to campus to start working. And as I said earlier, August 10th is when we expect to have the campus in a ready position to support, obviously the learning environment that our students are going to expect when they come back. And our faculty is anticipated to come back August 12th to report back in to get ready for the fall semester. So the last week of July 27th could be the earliest, but for sure the week of August 3rd for anyone who's going to be asked to come to campus as a part of their job duties. Now, that being said, as the president mentioned earlier, high focus, the objective is to keep as many people teleworking that we can, because we want to keep the density on campus as low as possible, but we also understand that there are some positions that we need on campus to help provide the services to students and to provide support to the campus that can't be done remotely.
Thank you. There's a question about the symptom monitoring tool that Towson will be using. What if I complete that form, that online form, and say that I'm coming to campus and then I don't make it to campus? Do I need to update the form?
I'll answer that question, and I'll also ask my colleagues to be able to jump in on it. The symptom monitoring tool that we're going to have is the fact that we're going to probably, when we finalize it, and this will be finalized in the next, probably the next 2 weeks, is we're going to ask everybody to do it every day, whether you're coming to campus or not. And part of the reason that that is a best practice that results is it becomes a habit, and it actually prevents the kind of questions that or issues that were just described. And it becomes like brushing your teeth in the morning. So you brush your teeth in the morning, take a shower, get yourself a cup of coffee, and then do the symptom monitoring. And then you can indicate the fact that there's an issue. So we really want to encourage it to become very, very routine for everybody to be able to do, so that you're not in a situation where you're saying you come to campus and then you might change your mind to be able to do that. But again, we're working actually with UMB, we're working with College Park and UMBC to be able to finalize those protocols for it. Sometimes there's the question of testing. And if I can, I'll take just a couple of minutes to be able to deal with that question. There are some folks that have asked, why don't we test and do a baseline test of everybody coming back? Actually, the research and the current research that is being provided, this is based on advice from UMBC as well as some of the epidemiologists and experts in that field, is that symptom monitoring is really the way to be able to go. And it is far more apt to be able to give the most accurate picture of what's going on in the campus in terms of the virus itself. However, we have a pop-up station that we've put up that deals with testing. And we're going to be able to keep that pop-up station up for the rest of the semester. It'll be appointment only, but we want to make that available to the community as well. But it's going to be symptom monitoring that we're going to rely on as our first semester. Steve, do you want to add anything about that I might have missed, or Ben in terms of pop-up, or Vernon's on the line, and I know that University Health has been doing that as well. So I'll step back and see if my colleagues want to add.
Now, on the symptom tracking, again, this is part of our community commitment, is we want to make sure that we're monitoring the health of the TU community. And the expectation is that everyone will participate in that process. And we will, we'll get reports to let us know if somebody, for some reason, had a symptom that was told to call the help nurse line. Because if you have a symptom that indicates that you got a fever, a cough, etc., we've got a resource available that you can talk to that can help begin to figure out whether or not you need to stay away from work, go get a test, and we'll be in constant communication with them. But we're going to be working very closely with our University Health Center. Vernon, I don't know if you want to mention some of the activity there, how that would integrate, that symptom tracking would integrate with University Health.
Sure. I'll just add, in addition to the other relationships that we have with UMB, UMBC, College Park, Dr. Matt Goldstein and our team in the health services are working regularly with the county health department and engaged with the state health department as well. So we're really leveraging all of those resources to ensure that how we go about supporting the health and safety of the campus is aligned with kind of the best practices from a research standpoint, but also alignment with what our state health department and county health department is providing guidance for.
Thank you. A follow-up to the symptom monitoring tool, how is data being protected in terms of those receiving the information, and what tool is being used to record the data and ensure that privacy measures are being put in place to secure people's personal and private health information?
I don't know whether Vernon or Ben or Steve want to be able to answer that. I think it might be Ben, because it's OTS, or Steve.
OTS, correct.
So we take the protection of this information very seriously. The tools that we're looking at right now, and the final decision hasn't been made, we're down to 2. Either one of those tools will be fully HIPAA protected. So you can rest assured that that will be in compliance with any federal regulation around the protection of and privacy of health information. In addition to the fact that once we determine that tool, we will also be taking that information and really keeping it only for a very short period of time. So it will be cleared and completely removed from the system at a maximum of 2 weeks, and it could be less than that. So the information is just being kept for a period of time where if someone in fact tests positive, we can do the appropriate contact tracing, and after that, all the information will be deleted from the system.
I'll make one other point that if in fact someone self-reports one of the symptoms, and if you've seen the symptom tracking, I think there are, I don't know, 14 different symptoms on there, as well as temperature. When the manager or supervisor gets notification that someone's not been cleared to come back, they have no idea what symptom it is. They just know that they haven't been cleared to come back. So we're really trying to make sure we manage the confidentiality of the information to Ben's point.
Excellent. This is a question for Vice President Hurt. Are students from states that have spikes in COVID going to be quarantined for 14 days prior to attending TU?
Any plans around quarantine from any significantly impacted areas will certainly be guided by state guidance and any other kind of CDC guidance. There are no plans at this time because there are no articulated guidance from those areas, but we're certainly will be prepared to adjust. We do have one of our towers that's going to be held as an isolation space. So depending upon any timing of change of guidance, if we see that, whether it's prior to students' arrival or closer to our scheduled move-in, we'll be able to employ either of those options of quarantining at home or quarantining on campus. But again, we have not received that guidance from CDC or the state. And so we're going to make sure our practice is aligned with those recommendations.
Excellent. And while I have you, a follow-up on students. The question was, how many students have indicated that they will return to campus and or specifically live on campus?
Sure. So we have over 3,000 active housing contracts in place now. So we'll have approximately just over 3,000 students who will be on campus. We have as well worked with off-campus apartment to get additional beds. We'll have just about 300 additional beds that'll be available. As you know, with the lower density plan, we're not going to have full capacity of our residences on campus, but this partnership will allow us to have some additional beds and housing options for our students in a format that really allows us to support our social distancing measures as well.
Just to be able to add, so that everybody understands what we've done with housing, and I have to say that the Housing and Res Life has just done a fantastic job in terms of sorting this out, and the leadership that Dr. Hurt has provided as well. We're treating everybody with singles. There's not going to be doubles. We're taking a look at the fact that there will be social distancing requirements just as anywhere else. Common rooms will be dealt with differently. We have the buildings that are in the front, the residence halls, Freeman and Scarborough, are not going to be open because of the fact that they would use communal restrooms, and that's not a requirement that we want to have. So there's been significant adjustment in terms of the residence halls, in terms of the living arrangements, to be sure the fact that we can be able to provide the social distancing that's required to have everyone be safe. And in addition, as Dr. Hurt said, we're taking one of the towers that was supposed to be remodeled this year, and we're delaying the remodeling and keeping it open for any students that we might have to quarantine, either because of the fact that they're symptomatic or the fact that they might test positive, to be able to isolate them there. So we have quite a number of beds available and are able to sort that out as well.
Excellent. Follow up, when the vaccine becomes available, will employees be required to get vaccinated? That's a question likely for Vice President Jones.
I don't know that I'm the right one to answer that question, but if a vaccine's available, I mean, I don't know that we're going to require anybody to get a vaccine. Obviously, people have to make independent decisions about whether or not they're going to get a vaccine. And I don't know that we're going to be in a position to require it. I can ask my colleagues on the call as well as the president if I'm wrong in that answer.
Yeah, my understanding, and I know enough to be dangerous around this because it's really a legal question in terms of that. And my understanding is the fact that the requirement that we cannot require any type of vaccine in terms of the campus, and we haven't even thought that far along. But we'll keep everybody updated. I hope that we sooner or later get into the position that there is a vaccine available, so that we do have to have a better understanding of that. But as of now, my understanding is that we would not be able to require it of the employees.
Thank you. This question's for the provost. Is there a timeline as to when faculty will be communicating with students regarding the structure of their courses? What percentage might be hybrid, face-to-face, and when will this be communicated to students as well as the campus?
So our expectation is that by the end of next week, all the course modalities will be identified by the faculty, and the plan that's been communicated already to students is that this will be uploaded into the course schedule. So every individual section will have a notation that indicates whether it's going to be asynchronous online, synchronous online, or a hybrid, which is what we're using as our description of face-to-face courses. So the expectation is we'll have the vast majority of those classes by the end of next week. Hopefully all of them, but there may just be a couple that we're working through, and some of the atypical classroom spaces that we'll be using may have to wait a week or so for us to sort that out. But my expectation is 95% of courses will be identified by the end of next week.
Thank you. We also have a question here, perhaps President Schatzel can answer it. It's about the fall sports season. Are there any updates or expected changes to the fall sports?
So we've welcomed probably about 70 athletes that are back. So there is some practice is going on, but it's not as it was before. And we're looking at the fact that they're being socially distanced in terms of conditioning. With regard to fall sports as it stands right now, I'm actually having a meeting this evening, a Zoom meeting with my fellow with the commissioners and my fellow presidents of the CAA. Every single conference is talking about whether we can effectively execute fall sports given the circumstances, particularly given the travel restrictions that we're seeing, that there's various states that are not providing the fact that, as somebody mentioned, the ability to be able to have people come from other states, and if you have to self-quarantine coming back and forth. And that's a very fluid situation, and it's changing. In Maryland, it's even more complex because of the fact that we have county regulations, where you might have a state directive that allows for something, but at a county level, depending on the circumstances, there could be issues that a county executive of Baltimore County might make a decision in terms of requirements or restrictions versus somebody in Howard County versus the county executive there. So there's a lot of logistical issues. So we're going to keep everybody updated. As I said, this is a pretty fluid situation as we're moving through this. But I am meeting with the CAA, and we continue to meet. The athletic directors continue to meet to be able to do that. And we'll keep you updated. There is no time deadline for a decision. As it stands right now, the conference is proceeding with plans to be able to have a sports season in the fall. But given the fact that this is a very fluid condition, and we've seen some of the changes in the last just 2 weeks, there's constant contact between the presidents, the ADs, and the commissioner with regard to that.
Thank you. Now we're going to shift to facilities just a bit. Vice President Lowenthal, more and more data shows that the virus spreads more indoors than out, lingering longer in the air. How has the HVAC systems across the university been updated to reduce the spread?
Thank you, Marina. It's an excellent question. So all buildings across campus have been shifted to maximize air intake across campus in all buildings. In almost all cases, that means that there's 100% exchange of fresh air on at least a daily basis. Now, the important point, two important points actually to add to that. In order to keep everyone safe throughout the day and cool, so whether it's cool this season or heated later in the semester, we also need to monitor that as well as make sure that the air is dehumidified. So while we will refresh the air intake at 100% at least a nightly basis, during the daytime hours, it won't always be 100% because we have to balance that against the capabilities that we have to ensure that the air is dehumidified, which is also a safety issue, as I imagine most people recognize. So we have been looking at those buildings very closely and have maximized the fresh air exchange, and we'll continue to do that throughout. And in many cases, in most cases, it's actually electronic, depending on the age of the building. So there are very sophisticated systems that enable that. In addition, what's really important for folks to understand is that because it's all monitored electronically and it's working through the HVAC, it actually is detrimental to open windows where the capability is to open windows. So where your building is controlled electronically and the air intake is controlled such that it keeps everyone as safe as possible, we do ask your cooperation in not opening the windows. If you do open the windows, that actually negates much of what we can do to keep the air intake at the highest levels possible.
Thank you. Vice President Hurt, the next question's for you. Will the Burdick Hall Recreation Center be open? And will mask wearing when working out, such as on the treadmill or lifting weights, be required? Most local gyms are not requiring mask use.
So yes, Burdick Hall will be open. We anticipate limited hours and certainly adjustments to the exercise equipment use, again, trying to keep in mind social distancing. We will require some level of mask use within the facility. We're still working through the finalized kind of procedures and policies around mask wearing. But again, we're going to be aligned with our mask wearing expectations on campus, and we'll expect that masks will be used for the most part within the building.
Thank you. And a follow-up to that is how often, and this might be a question for Vice President Lowenthal, how often can you get a mask from the Office of Public Safety, and what kind of masks are they providing?
So the masks initially will be provided through the care kit that we mentioned earlier. And the expectation is that everyone uses those masks and washes it daily as required by CDC guidelines. And that is the mask that we are requesting that all folks who are coming to campus use. However, we recognize certainly that things happen, people can forget, and TUPD does have a supply of masks and a lot more than that, other PPE as well. So at any point in time, if there is a need, one can stop by and coordinate with TUPD to pick up those supplies.
Thank you. There's a question around when visitors come to campus. Will there be regulations in meeting spaces for staff and visitors in terms of using small meeting rooms versus larger open spaces? And then a general question around event space itself and how will that be monitored given that some academic courses will be able to use event spaces?
So let me take that. We don't want to have meetings on campus. I mean, I think we need to turn our heads a little bit to understand the fact that we do not want to encourage the campus use when it can be done via Zoom, when it can be done via WebEx, when it can be done with a telephone call. So in terms of circumstances where we would have people come to campus, it would be on exception to be able to manage that. And I know that there would be circumstances that might occur. It could be vendors, could be taking a look at facilities, a variety of circumstances like that. But, you know, again, what we want to emphasize is the fact that, you know, telework and being able to conduct business as best we can remotely is what we want to emphasize. So people coming to campus would be truly exceptional. And we've done it actually with events and conference services. We are not providing for the fact that there's any third-party use of our facilities at all. So there will be no renting out of any of our facilities, in part because of the fact that we didn't want people walking through the campus that weren't part of the campus community, and we wanted to bring the density down and keep it to our community members only. And in addition, in terms of taking a look at the use of classrooms and lowering the density on the classrooms, we wanted to make that space available to the provost. So West Village Commons, South Campus Pavilion, the ballrooms, for example, we're going to open those all up for rooms to be able to use for classes. So as a starting point, I want to make sure that that's where we start. We start with the fact that we don't want to be able to have a lot of visitors to campus. We do not want to have meetings occur on campus that can be just as easily done on Zoom, and therefore provide for the best conditions for everyone. Provost, in terms of the rooms, you want to share a little bit about that?
So we're looking at maximizing our ability to offer courses, of course, face-to-face. And so we've identified West Village, a number of different large spaces, West Village Commons, the pavilion, the theaters scattered throughout campus, and are currently working with facilities to identify what the appropriate density is for classes in each of those spaces. And so we'll be scheduling those very soon to be able to offer as much of that face-to-face experience for our students as we can. We're prioritizing classes with large freshman enrollment because we know that that's a really important part of the first year experience. And then we'll work backward from there to look at some of the other classes. But that's our priority scheduling, and that will be happening in the next few days.
And I'll just add from a co-curricular standpoint, as you've heard, we're certainly prioritizing our space use across campus, really trying to be creative for our course delivery. But we're going to have students on campus, and so we want to make sure that we have as vibrant of campus life available. And so we're going to be looking at, again, through creative lenses, how we might use space across campus to have some level of co-curricular engagement for our students as well.
All right, next question is, given the recent spikes in the country, what is the plan if and when an outbreak might occur in the area, on campus, or across the state? Will students remain on campus, and is there a, in quotes, leaving TU plan?
Let me take that. The reason why we initially left campus is because of the fact that it was an executive order from the governor to be able to vacate. And again, what we're going to do is be compliant with CDC as well as state and local regulations. So those decisions, I can tell you, are going to largely be made by those bodies in terms of it's a statewide or a countywide type of situation where we would be asked to be able to vacate the campus. So in any of those circumstances, we will absolutely comply with it. But as you've seen, we've been fortunate in Maryland in the fact that we've been able to reopen slowly, and so far the positivity rates have been reasonable for us to do. But as you can see, everybody is monitoring it. And of course, we're going to be compliant with whatever the county as well as the state provides for us on the CDC.
Excellent. Another question is, will staff be notified if others on campus have been diagnosed with COVID? And then there's also a question about the pop-up testing and whether or not that will continue to be available in the fall.
So I'll take up the pop-up testing, and I think in terms of the notification, I'm going to ask that either Steve or Ben answer that. The pop-up testing we're going to keep available into the fall. As I said, it's up now. What we want to be able to do is to have it available for our faculty and for our staff to be able to make use of it. It's not going to be a requirement. I want to make that clear. People are not going to be tested because the symptom monitoring is what is the preferred method at this point in time. You're going to have to make appointments, so there will be some issues of capacity, but we are going to maintain it so that we can provide that service to the community. With regard to the reporting, I'm looking to either Steve or Ben.
Yeah, I'll take it. If there is a positive test and we get notification of a positive, the contact tracing, we're partnering with Baltimore County on the contact tracing, but we also have an internal mechanism that is going to help us in anticipation of potentially a positive test, to make sure that we give notification when there is a positive, because we want to notify as quickly as possible, obviously, for a variety of different reasons. It's to make sure that the individuals are aware, as well as making sure that we can appropriately clean an area, to get it disinfected appropriately based upon whatever role the individual was in. But as far as campus notification, it won't be a campus notification. It'll be the notification would be isolated to individuals who would have interacted with that particular person if in fact they test positive. If we have a supposed positive, but not a confirmed positive, we would not be going around doing notifications. We only are going to be notifying when we definitely have a positive test result. And a lot of that has to do, obviously, with HIPAA and trying to make sure that we're, protecting the confidentiality of the individual involved.
Excellent. Another facilities question. This one is about bathrooms. So, Vice President Lowenthal, is the size of available bathrooms being taken into consideration with regards to density? There's concern about returning to an office that uses a very small bathroom that only fits perhaps 2 people at a time, without a large waiting area. And then a follow-up, we also had a question about whether or not lids would be installed in bathrooms.
Both excellent questions. I'll take the first one. We are looking at restrooms across campus, and there will be signage outside of each one with capacity, so many tigers per bathroom, as well as there'll be floor signage by the sinks, with 6 is safer, making sure that folks are keeping 6 feet apart as much as possible. That said, what the sign says at this point is that the partitions in the bathrooms actually, as well as the mask wearing, is the best protection, as well as trying not to spend too much time there. And all of that combined will keep everybody safe. So there'll be a maximum again per restroom, and there'll as well be floor signage outside the bathroom so that if there is a line forming, everybody will know to keep the 6 feet distancing that is required. In terms of the lids, that is an excellent question that has actually been raised at a USM level. It's something that, of course, no one ever really thought about, needing the lids, but now we have a situation where it apparently might help. It's just a very difficult question that we haven't actually finalized yet. There's some discussion, again, at the USM level, whether or not it's feasible to get lids for the number of toilets we actually have across the system. At this point in time, I would say it looks to be very difficult, but that is continuing to be researched.
Thank you. While I have you, Vice President Lowenthal, there's questions about food services on campus. What will dining halls, cafes, and catering look like? Will these facilities be available to both faculty, staff, and students?
Yeah, excellent question again. And here's where we follow the guidelines of both the federal government and the state government. And at this point in the state of Maryland, dining facilities are allowed to have 50% capacity. What we're planning to do is the food will all be takeout. So we have options where you can walk in and get the food that is being offered at a given point in time and take it to one of the many areas that the president mentioned earlier that we are ordering furniture for. So there'll be outdoor seating areas. There will be indoor seating available as well at 50% capacity with appropriate distancing. And there are a few venues that are not going to be open due to the expected lower density on campus. We've shared those details on the fact, just to give you just a couple examples. So the Glen Dining Hall is actually reopening. It has been completely remodeled. And then Susquehanna is going to be closed due to the construction in the Union, as well as the Newell Dining Hall is going to be closed. We'll just be using Newell Den to serve students and or staff and faculty in those areas. So the dining will be available to everyone that is on campus, and you will have options and choices as to how you want to spend your time there, whether or not you want to stay indoors or take it back to an office or go outdoors in one of the many available areas.
Thank you. The next question is for the provost. Has TU's daycare finalized their plans for the fall for the little ones and for the student teachers?
So I don't have the details in front of me, but they have put together a plan for, again, low density, following all the it's obviously a highly regulated industry, and so the daycare will be open at, again, lower density with all these safety protocols that are rightly required by the state and the county. So stay tuned. Those specific details will be coming out very soon, but it will be open.
Thank you. Back to Vice President Lowenthal. Question about parking. What is the plan for fall 2020 in terms of parking rates? And if they're designated to work primarily in a remote format and not to purchase a parking permit for the fall semester, will they need to purchase a daily permit in order to stop by campus?
Thank you. Another good question. So we've mentioned this previous. I'll repeat it again. The parking rates for the fall semester will be at 50% of the previous price. So we're, number one, going to be charging those only per semester. So rather than a full year permit, the permit would be for the fall semester only, and it would be at half the price of what it was last year. And whatever level you were paying, that will not change regardless of whether there's been any changes in terms of salary. So we're keeping all of that as the same as the previous semester, and it will be at 50%. For those who are not coming to campus very often, yes, you will be required to purchase a daily permit, and those permits will be available as usual. So if you're not coming often, that would probably be the best path to take.
Thank you. The next question is for Vice President Hurt. Will campus events, particularly those among students that we typically program, will those still be occurring this semester, this fall?
Sure, we're continuing to work towards the plans again. From a space planning standpoint, we're working through assigning spaces to classes. And then we do have a work group, a team that's looking at campus programming and events. So we do want to have some level of programming and events for our students. We're going to maximize and optimize our virtual options through WebEx, through Zoom. So many of our, for example, student organizational meetings will take place either in kind of hybrid form or primarily virtually. But we do want to be able to have some campus events on campus. Significant, very large events. Many of them won't be happening just based on facility, space, and our needs around social distancing. There's just really no safe way to be able to do those very large scale events. So you will see those adjustments. But again, we're going to have students on campus, and we want to have as vibrant as possible campus life given our constraints due to the pandemic.
Thank you. Next question is regards to TU serving as a polling location for the upcoming presidential elections in October and November. Is that still the plan? And does the deterrence of third-party events on campus perhaps change those plans?
So I'll start, and then Ben, you can move in. We changed the polling location to South Campus Pavilion last year because of the fact that it was obvious to us as well as to the voting organizations that making use of the admin building lobby was just nonsensical. So we moved it over there. I guess what we're going to have to do is take a look at how that's going to work out. Ben, I don't think we've received any update with regard to that. So it would be that early voting would, as it stands, kind of fit in that area, but it's probably something we need to follow up on. Do you have any update on that?
We're in constant contact with the local voting authorities. I don't have a recent update. I know we were talking about it. Of course, it's very difficult to really predict what things will look like at the time of the actual vote, but we're in constant contact. They did approve, as the President mentioned, the South Pavilion for voting, and we'll continue to talk to them up to the date of the actual, both of the actual election and the early voting.
Thank you. We're just about at a minute left. A few more questions. We've already answered 135 questions. So thank you to everyone who's participated. Can someone speak to the Faculty Staff Assistance Fund, its function and ways in which folks can donate?
Yeah,
Steve, do you want to take that?
Sure. Of course, it was a newly created fund that we put in place back in the spring. We recognized that while we had an outlet for our students, we didn't have an outlet for our faculty and staff. And through the tremendous support from the group in advancement and some very philanthropic and generous people, I think close to $30,000 was raised to support requests. We've received a handful of requests. We actually were a little disappointed because we thought we were going to get more requests. And I'd like to just encourage any of you that are on this Zoom meeting and anyone that you know that may be facing some sort of a financial crisis to avail yourself to the fund, because the dollars are there to help people in need. And we want to make sure that word gets out, that that's for faculty and staff. It's an emergency situation. It's not just limited to COVID. It's financial assistance for financial emergencies, regardless. And we want to make sure that word gets out and that people feel comfortable. It's a very confidential process. It's a very small number of people. In fact, there are only 3 people that actually review any of the requests that come in. And again, they're handled expeditiously, typically within 48 hours. So it's a quick turnaround, and we don't ask for a lot of information unless there's a need to, because we know when somebody gets to that point when they have a need, that need needs to be addressed and needs to be addressed quickly. So anything that you all can do to help us market that would be greatly appreciated. But again, the funds are there. We're going to continue to have it past the COVID event. This is going to be a standing fund going forward for financial emergencies for faculty and staff members.
One more question about the outdoor and the designated outdoor areas. How has TU provided additional accommodations for outdoor seating and areas for folks to congregate, and how will those areas be disinfected? President Schatzel, you want to talk about a few of our plans?
Yeah, as I said, the area around Stevens Annex has outdoor furniture that's put in place right now to be able to do that, and we've got on order that will be delivered in the next 6 weeks, that we're planning to put more outdoor furniture by the CLA, as well as the fact we want to put a lot of outdoor gathering space within West Village Commons to be able to do that. The cleaning would just be part of our routine cleaning that we would have on campus. So we have a very deliberate method that we're using to be able to clean all the spaces around campus, as well as the buildings themselves. I don't know exactly what the requirement would be in terms of cleaning those spaces with regard to the fact that they are outdoors, but I know that it's part of the protocols that we're all looking at. And again, one of the things that we've talked about is there's over 200 stations that we have available for wipes and sanitation, as well as providing it. But it's something that we're looking at constantly in terms of making sure that we're up to date and that we're taking a look at all areas to make sure that they're properly sanitized. I in fact, am looking forward to the outdoor space. I think it's going to be an important part in addition to the campus that we hadn't thought about before.
Just one brief addition to that is that any area that's food contact is considered one of those areas that's high contact. So ABM, our third-party vendor, will be paying special attention to any area in which food is coming into contact.
There you go.
The outdoor areas will have food. They'll be cleaning those multiple times daily.
There you go.
Next question, and I'll make this the last question, is for the provost. It says, can you speak to what the October graduations are going to look like, particularly for those who will be attending? Will there be any requirements for them to do any symptom monitoring or temperature taking, as well as masks? Can you talk a little bit about that?
Sure. So we're pretty excited about the opportunity to give our spring and summer graduates the ceremony that was canceled. So there's a group that's been working very hard on the plans on how to have a safe and physically distanced commencement ceremony that's meaningful and very celebratory. So they've identified United Stadium, so it's going to be outdoors. So that already ramps up the safety level. Everything's spaced out. That will have the 6-foot distance. So the number of students who can graduate in any given ceremony, I believe, has been set at 300, and I think that number is based on the physical spacing that we have in United Stadium. So there will be 6 ceremonies. Students will be able to bring get up to 6 tickets for people to attend. And again, the idea here is any of these outdoor large events, the family can cluster together, but everybody else must be spaced out. Masks will have to be worn, right? That is part of our campus policy, and that doesn't change during commencement. But we are expecting to have a really nice event for the students and for their families. And so those are the plans as they stand. We're hoping to have some nice surprises to make this just a great event, because the students deserve it. But it will be, again, done with all the safety protocols, all the CDC guidance, everything that the county and the state requires. So we'll be following all those same protocols for that ceremony.
Thank you. We're at 10:05, and so I'm going to end it here. We've answered nearly 140 questions, and I'll remind everyone that we'll continue to update the FAQ on towson.edu with any remaining questions that we weren't able to get to today. President Schatzel, I'll turn it back over to you.
Thank you, Marina. Thank you, everybody, for coming this morning and to be able to have the opportunity to hear the questions and the concerns that all of you are bringing forward. I hope that we've done a good job answering the questions that you've posed to us, as well as the fact that Marina's pointed out that there's frequently asked questions and lots of other information that's available, as well as the fact that we put resources out for faculty and staff on a weekly basis to be able to have everybody take a look at. The next 6 weeks are going to be critical in terms of being able to start the return to campus and the return to classes. And again, I just want to thank everyone for what they're doing to be able to support that. A couple of things that I want to continue to emphasize. One is, don't come to campus by yourself. Please don't show up. Over the next 1 to 2 weeks, you're going to have your supervisor be talking to you to be able to better understand what the work requirements are. Again, we're going to emphasize teleworking as much as we possibly can, either full-time or part-time. So we'll provide for that kind of flexibility. And it's because of the fact that we want to encourage low density on the campus. And also, if you come to campus or have to come to campus for whatever reason, the safety precautions are going to be there, which is going to be a mask on campus, and social distancing is going to be required. People have asked about the mask, and one of the reasons we emphasize it is that studies have shown that if you wear the mask, you actually socially distance better, that it's a reminder to be able to do the social distancing. So it's a practice and it's a habit that we want to do, as well as include the symptom monitoring. But we look forward to welcoming our students back. Our mission is to be able to provide for transformational educational experience to our students. And we want to be able to continue fulfilling that mission as I know everybody else does. So again, thank you for everything that you're doing to be able to support each other and support our students. And I look forward to being able to see you virtually again. We plan to have another town hall probably in about 2 weeks in terms of the staff, but there are also some town halls next week that I know that you're going to be informed about as well. It's important that we keep asking questions and we do our best to be able to answer them. So stay tuned for more opportunities to be able to have your questions answered. Thank you very much.